Thank you, Madam Deputy Speaker, and may I congratulate my honourable friend for securing this debate and speaking so powerfully. Last Friday we had the honour of welcoming the Baton of Hope to Bathgate, Blackburn, Armadale and Linlithgow as it made its way across West Lothian. The county was the only Scottish stop as the baton travelled the United Kingdom, carrying a message of hope and purpose. The baton of hope, as we've heard, is a powerful symbol in the national conversation around suicide prevention, and I must give my personal heartfelt thanks to Donna from Nails Hugs for working so hard to bring the baton to our home. For Donna, the Baton of Hope and Nails Hugs Foundations are a beacon of light in the darkest times. Living with the loss of her son, Donna has dedicated her time and love to give others the compassion they need, and she does it with an open heart and open arms, wrapping everyone she meets in the biggest hug. But the Baton of Hope's presence in our community was more than ceremonial. It was a rallying cry, a reminder that hope is not abstract. It is built, it is carried and passed on by people and a great many community organisations that I have been fortunate to meet. Only last week we had the opening of the Bathgate Men's Shed led by Alan. This is a lifeline for men facing isolation during retirement perhaps or mental health challenges. The entire shed movement is a brilliant example of how workshops are places of camaraderie, purpose and healing, and it would be remiss of me not to mention the inspiring work of everyone involved in Andy's Man Club across the country, with a special mention to Sandy, who told me about the work in Bathgate. These organisations, and there are too many to mention, often have the reach that health services and local government simply do not. They're also doing vital prevention work in local communities to keep people mentally well. They're not only transforming lives, but they're very often saving lives. For example, organisations like Smile, led by the inspirational Declan, support children and young people affected by poor mental health. Their counselling, advocacy, outreach and community building efforts are nothing short of heroic, especially when they receive no specific funding for the soaring number of referrals from medical services. Another local organisation, Environmental Health Kick, with June Dixon at the helm, provides life-saving mental health first aid training in local communities. They meet people where they are, with empathy, dignity and understanding. But whilst we are thankful for the hard work of many organisations, like those I have mentioned today, we cannot continue to rely on the goodwill of volunteers and charities to plug the gaps in our mental health system, which is stretched beyond breaking point in Scotland. The Baton of Hope passed through my constituency, but let it not pass us by in this chamber today or tomorrow. We must carry it forward with action and political will to ensure that no one in Scotland or the UK will wait until it's too late for the help that they desperately need.